So hello friends, welcome back to my channel. Today we will be dealing with the topic parts of tooth. This is the continuation. So let's begin with any further ado. You can see this pink line, the pink part I've shaded. This is nothing but the enamel, the outermost covering of the crown. And this purple line, this part, it is called the cementum. And you can see the junction of this pink and purple, this black line. Yes, this horizontal one, this is called CEJ or cemento enamel junction. It also has another name, that is the cervical line. Okay, moving on. Anything above this CEJ is called the anatomical crown, and anything below it is called anatomical root. So this concept is very important, as the clinical crown and clinical root, they are different, as like it is not that whatever you see is the anatomical crown. Anatomical crown is divided by the CEJ, the cervical line. So anything above it is called the anatomical crown. I've written AC there, and below it is called anatomical root. I'm writing AR over here. Okay, and that basically anything above the gingiva, this orange line is the gingiva or the gums, which we can see by our eyes. That is the clinical crown. So this portion will be the clinical crown, and below this orange line, that is the gums, that is inside the gums, we will have the clinical root. So I hope the difference is very clear. What is anatomical crown, what is anatomical root, clinical crown, clinical root. Okay, now this point where these root bifurcate, this is called the furcation. Okay, and the area between this cervical line and the furcation, it is called the root trunk. Okay, this is the root trunk, and yeah, this one we know that the root will have, the tip of the root is the apex. So here basic terms we are clear with. Now let's move on to the next diagram. We will be dealing with the different parts of one tooth. Okay, this I've made the front view of the central incisors. So I've made three parts, horizontally and vertically. These lines are dividing the tooth. So we will be naming each part, but before naming them, let's just be clear with all types of views or aspects of one tooth, because these parts, the namings will be related to the surface it has or it is facing. Okay, so let's just list down these views. There are 5 views for any tooth. Let's see what are those. So you can also say aspects. So this first one is the labial aspect, which I have drawn just now on the diagram. Then we have the lingual aspect, that is the behind back one. And then we have distal and mesial aspect. And this last one, near the incisal edge, we will have the incisal or occlusal surface. Okay, so occlusal is for the posterior teeth like molars, premolar. Incisal is for incisors. Labial also has another name, facial, so facial surface. And distal and mesial are also called as proximal surface or lateral surfaces. So distal is always away from the mid-sagittal plane. And lingual is also called palatal surface because you know the hard palate, right? That is why. Now coming on to this diagram, I want you to focus this. We will be naming all the parts accordingly. Alright, so let's start with the vertical parts, these sections. Yes, so this part is, if this midline, the mid-sagittal plane, alright, I'm assuming it's here. So this is the midline. I have showed you in the previous video, just go watch the part 1, okay, of introduction of anatomy. This will be the distal, then middle third, and then the part closer to the midline will be the mesial third. Okay, distal is away from the midline. I hope this is clear. So now we will be doing the horizontal sections. As I had showed you the cervical line CEJ. Okay, so this and this part, this will be called cervical. Why? Because these two parts are closer to this cervical line. I showed in the previous diagram also. Yeah, this one. So cervical line, this one. So this in the crown and even in the root, both these parts are close to the cervical line. Now this one is the middle part. Even in the root, middle third, and this middle third, and then in the crown we have near the incisal edge, we have this incisal third. Okay, it's very simple. Wherever these are located, we have named as such only. Incisal third, and in the root we have the apex. So near the apex we have the apical third. So these are some basic concepts which we should know. We will be using these terms later, that's why.